So I'm going to talk about some of the challenges that happen in the postpartum period. One of them is breastfeeding, in no particular order of importance, okay? So I'll talk about breastfeeding challenges. And as I already alluded before, breastfeeding can be a problem. And one of the main problems is having no milk. So immediately after you get a baby wants to feed. And one of the things that we even say, once the baby has been born and mother is okay, baby is okay, put your baby on the breast, try to start the process of breastfeeding. It doesn't always happen automatically that milk production is there. There are those people who have totally dry breast, and even if you put the baby there, they suck, and nothing comes out. This can be very frustrating. So low milk supply or no milk at all can be very frustrating. Let me just tell you that it is very normal. It's according to your own body physiology, the human body. It is okay for the process to take even up to 72 hours, that is 3 days, before milk production happens. And in this period, it is okay to use formula. It is okay to let the pediatricians advise you on the feeding of the baby. So don't feel very frustrated, because the more you're worked up about it, the more you're stressed about it, the more the milk doesn't come out. So just try to relax, continue latching the baby, continue being with the baby around you, what we call rooming in, listening to the coos of the baby, listening to the cry of the baby, listening to, smelling the smell of your baby. They're all some of the things that stimulate your body to produce this hormone for breast milk. And the more you also put your baby on the breast, the more the body communicates to the brain that it needs to release the milk, and the milk eventually comes. So be patient, and the milk will eventually come. Some people, once the milk comes, it's still not enough. There are those ones who struggle with very little milk supply, and there are those ones who have excess. And most of the time, the people who have less milk, they feel very frustrated because maybe your baby is not having enough, and you feel like, maybe I'm not a good mom. I'm already failing, even with this simple task of nature, Again, people are different, and even in the same person, different pregnancies and childbirth experiences are very different. There are situations where you get a baby and you have a lot of milk, and then the next time you give birth, there is no milk, and this is totally okay. So be patient with yourself, be yourself, don't try to compare yourself with someone else. If your milk supply is low, try to talk to your doctor and see what can be done to try and improve the situation. Sometimes all you need to do is give yourself time. Sometimes all you need to do is just, relax and rest in your mind. Don't be very stressed. Maybe all you need to do is just get some good rest and good sleep. And sometimes all you need to do is just work on your nutrition, and good nutrition is very important when it comes to breastfeeding. I always remember a lactation manager in our workplace who keeps saying, drink for 4, eat for 1. So drink a lot of fluids, and warm fluids, especially the ones that contain malt extract like Milo, like another one called Ovaltine, they stimulate a lot of milk production. So drink. And one thing to remember about drinking is that try to limit the amount of sugar in it, because the more you drink, and this is quite a lot of volume, if you keep putting spoons and spoons of sugar in it, you deal now with another problem of gaining too much weight. So drink a lot, even just a plain water. You can do even up to 3-4 liters a day, because even as the baby is breastfeeding, they get a lot of fluids from your body. So keep rehydrating, and the drinking can help a lot with just milk production. And of course, there are some other types of foods that also helpful with milk production. So things like fennel seeds, fenugreek, things like some vegetables like saga, they help a lot with milk production. Of course, drinking lots of soup and porridge, which have generally fluids, they help a lot of milk production. So try those ones. And sometimes when we try everything and nothing is working, we can also give a medication to just try and stimulate breast milk production as well. But check with your doctor. Don't prescribe this medication for yourself or buy over the counter. Okay, Sometimes it could also be a problem that maybe it's your nipples are retracted, they have gone back inside, and therefore the milk is not coming out. So also just checking with your doctor to make sure that they do a physical examination to see if there is anything that can be addressed around this. It's also important. And sometimes maybe it's just the ducts, the pipes that produce the milk maybe are blocked and milk is not coming out. So again, address with your doctor and see what can be done. The important thing is don't feel frustrated, don't feel stressed up, because even if you stress, you're just making the situation worse instead of helping. A day at a time is important. Another issue or challenge with breastfeeding is excessive, so the opposite of lace. So the women who have a lot of milk and it just keeps dripping, wetting your bras, wetting your clothes, and sometimes you may feel a bit self-conscious and embarrassed about this. And sometimes actually, apart from it being excessively coming out, it can also lead to engorgement. So you get that your breasts become very swollen and painful, and feel like stones literally because of the amount of milk in it. So breast engorgement is also a problem. And one of the ways to go around this is to just make sure that you take a warm shower. When you take a warm shower, it helps the milk to come out, especially when you're just about to breastfeed. Also, sometimes just massaging your boobs gently with some warm compressors. You can use a face towel, put in some warm clothes, squeeze it out, and just compress your boobs. It helps with milk production. And of course, frequently feeding the baby as well. If your baby is having more than enough, you can also express. So express the milk as much as you can. And this is also important because the people around you can also actually feed the baby, and this can also help you get some rest. So express the milk even as early as day 1 and store it in the freezer. It will always come in handy on a rainy day. Some of the other things, other challenges with breastfeeding is nipple retraction. So there are women whose nipples are not pointed out. They are pointing back inside, or it's flat. So that can be quite a challenge during the process of latching the baby. And of course, it's very frustrating for both the mom and the baby. And if left unattended, either the milk will not come out because now your body feels like you don't need a lot of milk because the baby is not breastfeeding, or sometimes now it could be engorgement because the milk is not coming out and your body is producing milk. So I would say address this with your doctor. We have lactational nurses who can be very helpful, and I know many who can even come to your home to help you. So speak to them. There are things that they can do to try and help the nipple come out, and this one can even be started even before you deliver your baby, to just help you with the latching process. And sometimes we may use what you call nipple sheaths, or even just during the process of expressing milk, it can also help the nipple to come out in the right position. So don't give up. Again, if you're one of these people, there is a lot of help, and we have a lot of lactational consultants who can help a lot with breastfeeding process. Okay. Some of the other challenges is infection. So breast can also get an infection, and during the time for postpartum, it's quite a vulnerable time because of all the breast milk production, and sometimes, again, the injuries that may come with the breastfeeding process. The baby may bite, you may get nipple cracks and things like that. So all those things may help. They may make you get an infection, what you call mastitis, or even sometimes a collection of pus in your breast, what you call a breast abscess. How would you know this? The breast will become very painful. It will be red in color. I mean, the skin changes will be around, it will be reddish and very, very tender. So if this happens, you may also experience chills, feeling very hot. Maybe you're even throwing up, feeling nauseated, and just feeling generally down and sick. See your doctor, because if there is an infection, sometimes you may need antibiotics, or sometimes you may even need surgery to drain a collection of pus if there is a collection of pus there. So don't stay with an infected breast in the house hoping for the best. Go get help, because help can be achieved, One of the other challenges is also nipple pain. So nipple pain is a common issue, especially in the initial days and hours of breastfeeding. Again, because it's a new thing for your baby. Sometimes they may not know how to latch well, so they may bite you, or with their gums. And those gums, I tell you, they are very tough. They can cause a lot of pain on you. So if you're having nipple pains, again, take it slowly. See how best you can latch your baby so that you also avoid things like nipple cracks, because nipple cracks can be a nightmare. And I know women who during breastfeeding, when they see their baby cry, they also start crying just because of imagining the pain that they're going to undergo during the breastfeeding process. So proper latching is a very important way of avoiding breastfeeding, nipple cracks. And also, of course, trying to apply your own breast milk. Your own breast milk is very nutritious. It has a lot of important nutrients and what we call antibodies in it. And we usually say that after every feed, apply a little of your own breast milk on the nipple so that it helps also to prevent the cracks and the pain that you experience. Proper latching and just applying that. And sometimes you may need some nipple creams that you can also apply and wash just before you feed your baby. That can also be helpful. All in all, if you are struggling with breastfeeding, don't feel frustrated, as much as that may be frustrating. Or even if you're frustrated, seek help. Don't stay with the problems just by yourself. There are many women who can help you with this. And we have these days a lot of nurses who can even do home visits and help you with this as well. So seek help and you will get the help that you need. And both you and your baby are going to enjoy.